In this lecture, we turn to restorative, sometimes called corrective justice. This form of justice addresses a different ethical question than the ones we have examined so far. While distributive justice asks who should receive resources, procedural justice asks whether decisions were made fairly, and retributive justice asks how wrongdoing should be addressed. Restorative justice asks how can harm be repaired when it has already occurred. Restorative justice shifts the focus away from punishment alone and toward healing, reconciliation, and the restoration of trust. In healthcare, where harm can occur even in the absence of wrongdoing, this approach is particularly important. At its core, restorative justice begins with the recognition that harm has consequences that extend beyond legal liability. When patients are harmed, whether through error, miscommunication, or system failure, the damage is often emotional, relational, and psychological, not merely physical. Restorative justice emphasizes acknowledgement of harm, responsibility, and meaningful repair. It asks not only what rules were broken, but what relationships were damaged and what obligations now exist as a result. This approach does not deny the importance of accountability. Instead, it reframes accountability as a commitment to repair rather than merely to punish. One of the clearest applications of restorative justice in healthcare is medical error disclosure and apology. Historically, healthcare institutions were reluctant to disclose errors, often out of fear of litigation. However, ethical practice increasingly recognizes that honesty and transparency are essential to restoring trust. When a medical error occurs, restorative justice supports timely disclosure, a sincere apology, and an explanation of what happened. For many patients, being heard and respected is as important as financial compensation. Disclosure and apology acknowledge the patient's experience and affirm their dignity, even when harm was unintended. Another application of restorative justice is compensation for malpractice. Compensation serves as a tangible form of repair. It recognizes that harm has imposed burdens, financial, physical, and emotional, that should not be borne by the patient alone. From a restorative perspective, compensation is not simply a legal transaction. It is a moral response to harm that aims to make the injured party whole to the extent possible. This approach contrasts with purely adversarial legal models, which can exacerbate conflict and deepen mistrust between patients and providers. Restorative justice is also evident in ethics-guided mediation between providers and patients. Mediation creates space for dialogue, understanding, and mutual recognition. Patients can express how they were harmed, and providers can explain circumstances, accept responsibility where appropriate, and commit to improvement. Such processes often reduce moral distress among healthcare professionals while helping patients feel respected rather than dismissed. Importantly, mediation can address systemic issues, not just individual failures. A key strength of restorative justice is that it recognizes that harm can occur without malice or misconduct. Healthcare is complex, and even competent, well-intentioned professionals can cause harm. Restorative justice allows ethical response without assuming blame or bad character. This makes it especially valuable in fostering a culture of learning and safety, rather than fear and silence. It is important to note that restorative justice does not replace retributive justice in all cases. When harm involves exploitation, abuse, or intentional wrongdoing, punitive measures may still be necessary. However, restorative justice reminds us that punishment alone rarely heals harm. Without efforts at repair and reconciliation, ethical resolution remains incomplete. To conclude, restorative justice offers a humane and ethically robust response to harm in healthcare. By emphasizing honesty, repair, and relationship restoration, it supports patient dignity, professional integrity, and institutional trust. Restorative justice helps healthcare systems move beyond blame toward accountability that heals rather than merely penalizes. In doing so, it reinforces a fundamental ethical truth. Justice is not only about rules and consequences, but about restoring what was broken.